When working with individuals with limited English proficiency, LEP, occupation is very important. An individual's engagement in occupation provides insight to what they find important and meaningful in their life and can be a direct reflection of their culture. If an individual does not speak the same language as the therapist, there is a risk that some of the client's cultural components of occupation may be misinterpreted or missed altogether.
There are many challenges and barriers that any one of us can face on a daily basis in regard to our healthcare needs. These barriers can then seem insurmountable if an individual is unable to communicate efficiently with their healthcare provider due to language differences. The U.S. Department of Health and Human Services provides a great deal of information on the subject of discrimination and how to combat inequalities via their website, hhs.gov. LEP is one of the rights protected by Title VI of the Civil Rights Act of 1964, which prohibits discrimination on the basis of race, color, or national origin. Please visit www.hhs.gov for frequently asked questions, guidance on services your client may be entitled to receive, and general information on how we can better serve those individuals with LEP.
Some of the problems that are seen in the health sector due to LEP are reduced health status, risk of complications of drugs, low satisfaction of patients, poor health outcomes, reduced follow-up visits, and lack of effective communication between patients and healthcare providers. Individuals with LEP encounter problems of understanding their medical condition, confusion on the use of medication, and have challenges in understanding medication labels, which presents a major barrier to medical comprehension. This can increase the risk of adverse medical reactions that can interfere with the desired healthcare outcomes of the person, which can affect their occupational performance. There are people with LEP that have been taken advantage of by their employers since they are unable to communicate efficiently and fight for their rights. Some are often paid low wages that cannot satisfy them and their families. These people often have a hard time understanding instructions being given and also take more time during training. Therefore, these challenges affect their overall occupational performance.
The importance of our unique role as occupational therapists while working with limited English proficient clients is our ability to address the needs of not only individual clients, but also groups and communities. The multifaceted and diverse skills of an occupational therapist allow for a treatment approach that can assist in advocating, educating, and even establishing support groups. We generate goals through looking at the client's occupational profile and analyze the client's occupational performance while identifying what is significant to the client or group. Overall, OTs aim to include achievement and preservation of occupational identity. Working with LEP clients, occupational therapists can provide opportunity to educate the community and allow for unity for the clients to provide support for each other.
There are over 300 languages spoken in the United States. So, how do occupational therapy practitioners assist and advocate for the LEP community in achieving their peak occupational performance? Steps must be taken on a personal, local, and global level to promote health literacy, which is defined as the promotion of personal wellness demonstrated by continually understanding, analyzing, and evaluating one's own health in a variety of settings. On a personal level, the therapist should incorporate therapeutic use of self, closely monitor their client's response during the sessions, use interpreters, picture cards, gestures, step-by-step demonstrations, and technology. Locally, facilities should incorporate cultural diversity education and community outreach programs to ensure multiple modes of communication are used. Lastly, there needs to be more advocating and research that leads to evidence-based knowledge to improve positive outcomes on a global scale. Thank you.
Merci.
Gracias.
Grazie. Kapunka.